Hello, I'm going to prove present case of dengue, and which was very interesting for me or different from the other cases, because here uh, the patient's fever had already come down from antibiotics, and but there was a very horrible pain which was there in the vertex. There was bodily pain, and there was post-febrile weakness. She was going undergoing antibiotics and IVF fluids. Now, on the day she came to me, she was told to stop whatever she was taking, and she was prescribed homeopathy. And in homeopathy, this case stands out because there were two competing rubrics. One was a pain in the vertex, which was only aggravated by coughing. So the pain the patient showed is exactly here, much more compared to the pain in the forehead, more in the vertex. And this pain, when coughing, she said it's terrible. That was the word that she used. And she could not bear this pain that was there. So the intensity with which the patient says was marked. Then there was also another rubric where there was bitter taste in the mouth on drinking water. Water as compared to food. Food, she could take it fine, perfect, but water, specifically water, there was bitter taste. And I was confused because I kept on having this confusion between China and sulfur, which were the two rubrics which came on repertorization. I'll just show you the. So you can see I took head pain vertex on coughing. Then from Boger's repertory I went to compound fevers beginning with chill and then heat. Extremities were very weak, and there was bitter taste in the mouth, so I took bitter taste in the mouth, but I took the rubric with 300 remedies, not the one with a very few remedies for water only, because I considered that maybe the taste altered because of antibiotics or previous medication also. So, in comparison, the pain, the intensity with which the patient felt that pain in the vertex, that was of more value than the bitter taste in the mouth only for water during fevers, which is a favorite entry point of mine. So, this shows when you shift or when you become a little more flexible in thinking, okay, though your usual entry point is there, but something peculiar crops up, and then that you take into consideration. So that was taken into consideration, and a simple rubric, sulfur, was given in this case of dengue. And within 3 days, on the third day, there was the lab test was repeated, and platelets had grown considerably. The weakness also reduced, and in 1 week the patient became normal. But this case, what it teaches me is your favorite entry points or your favorite so-called sure shot prescribers can often be misleading when something else which is peculiar in the case crops up. Or we should pay attention to where the patient emphasizes that something is unbearable or the patient's attention is drawn towards that. So, a simple case, but it taught me a lot, and even I was surprised with the lab results. So, go in for the generals, go in for the peculiars, and things turn out great. And always it reiterates my faith in homeopathy, and it teaches me that Dr. Gurvante sir's maximum value is often bought by a minimum syndrome. So just 4 rubrics and the case was solved.